my name is Anatoly Doroteo. I'm a registered nurse and at the same time I'm a grad student at the University of San Francisco. So today we're going to do a head-to-toe assessment for my final project. I have my patient down here. His name is Kenny. So for you to be able to do head-to-toe, the first thing you want to do is you want to let the patient know what are the things, expectations for this assessment. So Kenny, we're going to do a head-to-toe assessment. Part of the assessment is we're going to show a little bit of your some body parts, but it's going to be like one at a time. And at the same time, too, there's going to be a little touching, palpation, percussion on some parts. Is that going to be okay with you?
Yes.
Moving forward, while talking to the patient, you wanna assess also the mood, the affect, the posture of the patient. And in that case, for Kenny, he seems like he doesn't have any problems when it comes to posture. He seems like he's well kept. At the same time, too, he doesn't have any issues about body odor or any hygiene issues. I did a vital signs a while ago. His blood pressure is 125/85, heart rate of 85 beats per minute, RR of 20 breaths per minute. He's a about 96.5 Fahrenheit. His height is around 6 feet, 3 inches tall, and he weighs 190 pounds. The next part will going to be the assessment of the mental status. You want to ask your patient or Kenny, Kenny, do you know where you're at?
Yes, San Francisco.
Do you know what's the date today?
Today is May 5th.
It's Cinco de Mayo. Do you know what's the reason you're here?
Yes, I'm here for my physical assessment.
Part of the mental status, you want to also ask for mini mental state. It's assessing the basic memory, past and present of your patient. So, Kenny, do you know any who's our current president right now?
The current president is President Obama.
Do you know who's the president before him?
President Bush.
Okay. At the same time, to you, I'm gonna say something. I want you to repeat it after me. Big blue book.
Big blue book.
So, a patient is alert at times doesn't have any problems with past and present memory. The next part of the assessment, it's gonna be the skin, the hair, and the nails. Which is the first part. We're gonna be the skin. You want to assess for any bruising, any discoloration, any scars. So for Kenny, I don't see any scars, any discoloration of the skin, any wound, or any part of the body. After that, you're gonna go moving forward to the hair. You want to assess for the texture of the hair, the distribution, and for Ken's case, his hair is well distributed. His hair is shiny. Doesn't have any dandruff at all. Part of the skin assessment also is you will be able to see or inspect if his skin is appropriate for his age, which is Kenny, how old are you?
I'm 25 years old.
For 25 years old, he has a good skin, so it's appropriate for his age. After that, you want to assess for the nails. You want to assess if it's trim, if it's long, the color of the nail beds. So for Kenny, it's fairly trimmed, and he has a pink nail bed, so that's a normal finding. The next part, we're going to be the assessment of the head and the face. The first thing you're going to do for the assessment of the head is you want to palpate the scalp. You want to see if there's any bumps. Seems like the head it's pretty normal, no bumps, no indentations. And then you want to go assess for the symmetry of the face. For the symmetry of the face, you want to ask your patient to raise your eyebrow from you, Kenny. There you go. Make your patient smile. Can you smile for me? Okay, there you go. Part of it is that because some of a neurologic assessment is going to be affected if the patient has any facial drooping. For Kenny, his facial features is symmetrical. Moving forward, also is you want to assess for this sternomastoid muscle. So I'm gonna put my hand and I want you to push against it to see. Okay. How about the other hand? Sorry. So both of the sternomastoid muscle has an equal strength. And then after the head and the face, we're gonna assess the eyes. For you to be able to assess the eyes, you want to see and inspect um, any discharges of the eyes, if the eyes are symmetrical, or any periorbital edema. For Kenny's case, he doesn't have any discharges, he doesn't have any periorbital edema, and his eyelids are symmetrical. Also, at the same time, too, you will inspect for the sclera and the conjunctiva. Sclera seems to be white, and conjunctiva seems to be pink. After the sclera and conjunctiva, you want to assess for the pupil. If it's equal to light and accommodation, or parallel, people equally round reactive to light and accommodation. For you to be able to do that, is you want to have a pen light. So you want to shine on the pupil on the right eye. You would see that the patient that the pupil will gonna go constrict and dilate. On the other side, so Kenny's pupil is reactive to light and accommodation, both at the right and the left, right and the left eye. Moving forward, also is unfortunately I don't have any Snellen's charts, but for visual acuity. After the eye, you're gonna go move forward with the ear. For you to be able to assess the ear, you wanna have and inspect for the external ear if it's equal or it's symmetrical. For Kenny, it's equal and symmetrical. Ideally, you want to have otoscope. Unfortunately, I don't have any otoscope, so I'm just going to use the pen light for me to be able to see the internal structures of the ear, which probably you want to assess for the enseromen. So for adults, you want to go pull up and back. Okay, here. You want to go the other side. Okay, no cerumen, it's all clean. Another assessment for the ear is for the air conduction. For you to be able to do that is you have to have a tuning fork. Unfortunately, I don't have any tuning fork, so what you want to do is you want to strike down the tuning fork, and then you're going to have to put it on top of the head of the patient. Ideally, the normal reaction is the patient would be able to hear both of the vibrating sounds from the right and the left. The next part of the assessment will gonna be the mouth. For you to be able to see the mouth, assess for the mouth, you want to have pen light. You want to see for any sores, you want to ask the patient to say ah. So there you go. You want to assess for the soft palate. You can be able to assess also as part of the skin a while ago is the mucous membrane. It's pink. You want to see for any redness of the tonsils, for any inflammation. Of course, at the same time, too, you want to assess for any odors or bad odors. For Kenny, seems like he's well clean when it comes to the mouth. And you want to ask also if he could be able to take your tongue out and then move from the right to the left. Okay. Moving forward, after the mouth is gonna be the neck. For you to be able to assess for the neck, you want to see inspect the trachea if it's in the midline. Seems like or any abnormalities, his trachea seems to be in the midline. Other than that, you want to go and palpate for the lymph nodes. Lymph nodes is usually you want to start from um, the pre-auricular, the post-auricular, the tonsillar, submandibular, and submental here. You want to see the anterior cervical and the posterior cervical. So, well, by doing that, you want to use your the pads of your three fingers in a circular motion to see any pea-sized lymph nodes. But I don't feel any lymph nodes of Kenny. After that, you want to go and assess for the thyroid gland of your patient. For you to be able to do that is you want to, ideally you want to go sit at the back. You would feel the adductor muscle. You want to ask your patient to swallow. So the isthmus will going to go up. There you go. Also, while talking to the patient, you want to assess also for the hoarseness of the voice for the trachea and stuff. Can you speak?
Yes.
So he doesn't have any hoarseness of his voice. And moving forward, also you want to assess for the the muscles. Can you shrug your shoulder for me? Okay. So both of his shoulders are equal, had an equal strength. So after trachea, this is the time that or the neck area. This is the time that we're going to expose a little bit of his chest wall. Is it okay for me to expose your chest wall?
Yes.
So you want to inspect the chest wall. At the same time, too, that's when you can start assessing for the respiratory system, or part of it is the lung sounds or the lungs area. The first thing you want to do is to inspect also for any retractions, any use of accessory muscles. So for Kenny, he seems like he doesn't have any hard time breathing. No audible wheezing sounds. It's pretty clear. I don't hear anything. After that, you want to use your stethoscope for you to be able to hear the breath sounds of your patient. So Kenny, after I touch this, after the stethoscope touches your skin, I want you to have a deep breath. Okay. Okay. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So on the anterior side of the lungs, there's no his breath sounds are clear, and you want to do that also on the posterior side. I want to ask you to move a little bit forward. So pretty much the same. After I touch the stethoscope, I want to have you to have a deep breath. Okay. Inhale. Exhale. 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 So clear breath sounds. Moving forward, after the respiratory system, we're going to do the cardiovascular system. So you want to see the chest wall, and then you're going to go and look and palpate for the point of maximal impulse, which is located the fifth intercostal space, mid-clavicular line. So you want to palpate that. So I can hear the beating of his heart right now by palpating. Also, you want to palpate the carotid pulse or artery, but you want to do it like on one side. By doing that, use your 3 fingers. There you go. So it's palpable and it's strong. Good. The next part of the cardiovascular assessment is you want to assess for the sounds of the heart for you to be able to see the S1 and S2. The first thing you want to do is put your stethoscope, and we're going to do on the aortic area, which is located on the second intercostal space, right intercostal space, and then you're going to move forward to after the aorta. You're going to go to the pulmonic, tricuspid, and the mitral valve. So the aorta, you want to hear the beat on the aorta. So the pulmonic area is in this second side on the left intercostal space on the border. So aorta, pulmonic, and then it's gonna go on the tricuspid area, which is the fourth and fifth intercostal space near the border. And then the mitral will gonna be in the fifth intercostal space, fourth to fifth intercostal space. So I could hear the S1 and S2 of Ken's heart. No murmurs, no abnormal sounds that I heard of. The next part of the assessment is going to be the abdominal assessment. Part of the abdominal assessment is I'm going to ask the patient to lay down on bed so we can be able to assess further. So, Kenny, I'm going to ask you to lay down. Is that going to be okay?
Yes.
So I'm going to expose part of your abdomen also. So the first part of the abdominal assessment is inspection. So you want to see any scars, any pulsations, any contours of the abdomen. For Kenny, I can see the pulsations, the peristalsis also. Next part of the abdominal assessment is going to be the auscultation. So the abdomen has 4 quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So you want to assess for the abdominal sounds. So you want to start in the right upper quadrant. The left upper quadrant. The left lower quadrant. And the right lower quadrant. I could hear the grating sound of Kenny's abdomen sounds. The next part of the abdominal assessment is the percussion. This is usually like to gauge the tympanic sounds of the abdomen. The normal sound for the abdomen is usually tympanic because it's like a sound of the drum because you don't hear any water. It's just usually pure air. So for you to be able to do that, is you want to use your non-dominant hand, and then you're gonna strike your non-dominant hand of your middle distal finger, and you want to do strike, 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 strike. There you go. Okay. The next part of the abdominal assessment is going to be palpation. Um, but if you're going to do palpation, you want to start with the light palpation first. You're still going to do the four quadrants of the abdomen. So we're going to start with the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. You want to do a light palpation first because in that case, the abdominal muscle gets use of your touch, and that will go on for the abdominal muscle to relax, which you're going to move on to a deeper palpation. So the right upper quadrant. Any pain, Kenny?
No.
So part of the abdominal assessment, if you wanna, if is for you to see and feel, for you to feel the liver border. For you to do that is you want to ask your patient to have a deep breath, and then on the costal margin, press, and you would feel the edge of the liver. There you go. The next abdominal assessment, which is pertinent, is the rebound tenderness. The rebound tenderness is usually an abdominal assessment for appendicitis. So for you to be able to do that is you wanna, on the right lower quadrant, you wanna ask your patient, are you gonna press down, and then you're gonna ask your patient if, and then you're gonna let it go, and then you can ask the patient which one that hurt the most. If it's the initial phase of pressing it down, or when you let go of your hand. Positive rebound tenderness is usually it gets hurt. Usually, if the patient has the patient usually complain of pain after you let go of your hand. That, of course, that's indicative of symptoms of appendicitis, part of other diagnostic tests on that. Since the patient is laying down too, you want to assess for the next assessment you're going to do is the peripheral vascular assessment. So for peripheral vascular assessment, you want to see any discoloration of the lower extremities, any edema. I don't see any edema at all for the patient. You want to assess for the radial pulse. And then I'm going to take out your socks. So no edema on an ankle. And then you want to assess also for the dorsalis pedis pulse. And you want to compare it also for the radial pulse. So Kenny's pulse is really strong and bounding, which is a good sign because that means Kenny has a good circulation on it. Okay. Moving forward, I'm going to put the Moving forward for the next assessment is the musculoskeletal system. So Kenny, I'm going to request you to get up again and sit on the chair. While doing that, you should be able to maintain the privacy of your patient. So by assessing a musculoskeletal, you wanna ask for ask if you can squeeze my hand for me, both the right and left. Squeeze my hand. So the grip of Kenny's hand are both equal for the strength wise. The next part of musculoskeletal assessment is you want to ask the patient to walk. Gross motor walking. You would be able to see if how he walks. Come on, walk, Kenny. By walking, go back and forth. Again. So by walking, you want to assess if the patient has a balance, any patient has the strength of his ankles and knees and all that. Or while standing up, you want to assess also for for Kenny's curvature of the spine, for you to be able to assess if there's any scoliosis, lordosis, or kyphosis. By standing up, I don't see anything for any abnormalities when it comes to curvature. You'll be able to see that too if you're going to let patient bend a little forward. For you to be able, sorry. So bend a little forward. So you will be able to assess if any abnormal curvatures of the spine. But for now, I don't see any abnormal curvature of the spine, which is good. You want to sit down first. The last part of the assessment is going to be the neurological assessment. Part of the neurological assessment is you want to do a gross motor walking also, but we already did that in musculoskeletal, so I don't see any abnormalities when it comes to the gross motor skills of walking of Kenny. The next part of the neurologic assessment is the pronator drift. So for you to be able to do that is you're going to ask the patient if close your eyes and then extend both of his arms and then try to hold it at least for 30 seconds. For some individuals who have like a neurological defect, patient usually not be able to hold on to both of both arms of the patient. Yeah, hold on, try to hold on. Good. So Ken is negative for pronator drift. The next part of the neurologic assessment is the deep tendon reflex. So we're gonna have to assess different parts of the deep tendon reflex. The first part we're gonna be the brachioradialis. So Kenny, I want you to relax, and as I strike, hopefully we can be able to see the reflex. Relax. Oh, there you go. Again, 1, 2, 3. Okay. So that's brachioradialis. The second part we're going to be of the deep tendon reflex, we're going to be the patellar. So I want you to relax. Also, relax. Okay, there you go. Ideally, you want to do both. Relax. There. Good. Okay. Next part of deep tendon reflex is going to be the ankle. So relax. It's probably a little tricky, but I'm going to try. Oh, okay, good. Okay. Let's see the other one. There you go. Good reflex. The last part of the neurologic assessment is the Babinski reflex. So for you to be able to do that is you want to have a sharp object. Ideally, it's either a ruler or your percussion hammer. So the normal Babinski reflex is when you stroke the patient's foot, the toe usually goes extend. Okay. The abnormal or the passive Babinski reflex is that when you stroke the patient's heel up to the toe, the great big toe we're gonna flex, and the rest, the four little toes, we're gonna extend. So let's see for Kenny. There you go. Again. There you go. Oh, okay. How about this one? There you go. See? It goes forward. All right. So that concludes the head to toe assessment. I hope you were able to learn something, and I want to thank my instructor, Dr. Nancy Silix, for the patience and for the knowledge that she shared for us. That's all. Have a good night.